हेलो एवरीवन, वेलकम बैक टू अनदर वीडियो फार्मा रिसर्चर। तो आज मैं डिस्कस करूंगा जीपैट 2014 ईयर का क्वेश्चन पेपर, जिसमें हमने इनिशियली 65 क्वेश्चंस प्रीवियस वीडियो में डिस्कस कर लिए थे। तो इस वीडियो में मैं रिमेनिंग 60 क्वेश्चंस डिस्कस करूंगा। तो चलिए स्टार्ट करते हैं 66 क्वेश्चन से। सो द क्वेश्चन इज, as per Schedule Y of the Drugs and Cosmetics Act, the animal toxicity study requirements for marketing of a drug depends upon tentative route and duration of administration in humans. In this context, which one of the following statements is incorrect? So the incorrect statement is option D, that is multiple daily ocular application for short duration irrigation test in one species for 3 weeks. Next question is, for determining the efficacy of sterilization in an autoclave, the spores of the following organisms are used as test organisms. So the correct answer is option C, Bacillus stereothermophilus. Next question is, which of the following pairs is mismatched? So the correct answer for this question is option D, Pseudomonas gram-negative bacteria. So next question is, list of drugs whose import, manufacture and sale, labeling and packaging are governed by special provisions are included in schedule, and the correct answer is option A, schedule X. Next question is, sigma minus method is used in assessment of, and the correct answer is option A, bioavailability. Next question is, which of the plant family contains volatile oil in their trichome? And the correct answer is option D, Lavinaceae. Next question is, ferritin is, and the correct answer is option B, the stored form of iron. Next question is, which oil is solute in alcohol, soluble in alcohol? So the correct answer is option C, castor oil. Next question is, one of the first step of the citric acid cycle is isomerization of citric acid to isocitric acid. This step is necessary because, so the correct answer is option D, that is oxidation of tertiary alcohols would require oxidizing agents. Next question is, which of the following alkyl halides would undergo SN2 reaction most rapidly? And the correct answer is option C, CH3CH2I. Next question is, mechanism of action of ketoconazole is, and the correct answer is option A, that is it inhibits agosterol synthesis. Next question is, all are adrenal gland overactivity disorders except, and the correct answer is option B, Cohen's syndrome. Next question is, the oil used in a parenteral product cannot contain, and the correct answer is option B, that is paraffin oil. Next question is, identify the non-absorbable suture, and the correct answer is option C, silk suture. Next question is, the relative lowering of vapor pressure is given by, and the correct answer is option A, Weierstrass law. Next question is, identify the functional group present in meprovamate, and the correct answer is option C, carvamic. Next question is, match the following. So the first option, that is gypsum salt, it correctly matches with option number CaSO4 2H2O. Next is Epsom salt, and it correctly matches with option number 4, that is MgSO4.7H2O. Next is alum, it correctly matches with option number 1, that is KAlSO4 whole 2 12H2O. Next is green vitriol. Next question is FeSO4.7H2O. So the correct answer for this question is option B. Next question is, Tinea capitis is ringworm infection of, and the correct answer is option C, head. Next question is, Rank the following compounds in order of increasing reactivity in electrophilic aromatic substitution reactions. First is P is C6H6, Q is C6H5CH3, and R is C6H5NO2. So the correct answer for this question is option A, that is Q is having least, then P, and then R is having the maximum. Next question is dose dumping may be a general problem in the formulation of, and the correct answer is option C, modified release drug products. Next question is codeine differ in structure from morphine by, and the correct answer is option D, OCH3 group. Next question is isotopes differ in, and the correct answer is option D, the number of neutrons. Next question is arrange the given acids in increasing order as per the number of carbons present in them. P is capric, Q is caprylic, R is caproic, and D is lauric. And the correct answer is option B, that is R is having the least, then Q, then P, and then S. S is maximum. Next question is E1CB, that is elimination reaction by conjugate base, which reaction intermediate will form? So the correct answer is option B, that is carva anion. Next question is what are the three basic steps of conventional PCR? And the correct answer is option B, denature, anneal, and extension. Next question is Ravi's bodies are, and the correct answer is option A, Negri bodies. Next question is when glucose reacts with bromine water, the main product is, and the correct answer is option D, gluconic acid. Next question is increase in melting temperature of DNA is due to high content of, answer is option plus G. Next question is what will be the primary product of the following reaction? And the correct answer for this question is option number C. Next question is the mass spectrum of a compound with an approximate molecular weight 137 shows low equally intense peaks at m by z 136 and 138. What does this suggest? And the correct answer for this is option B, that is the compound is alkyl bromide. Next question is capping in tablets mainly due to, and the correct answer is option D, due to entrapment of air in tablet during compression. Next question is how can we detect the rhizome from the root of Rauwolfia? And the correct answer is option A, by the presence of small central pit. Next question is drug of choice to treat H1N1 influenza is, and the correct answer is option C, oseltamivir. Next question is identify the correct statement. P is condensed tannins are polymers flavans. Q is condensed tannins do not contain sugar residues. R is hydrolyzable tannins are polymers of gallic acid or ellagic acids. S is gallic acid and catechin are pseudotannins. So the correct answer for this is option D, that is P, Q, R and S, that is all the statements are correct. Next question is quick breaking aerosols are applicable, and the correct answer is option C, topically. Next question is in the Reimer-Tiemann reaction, dash reacts with phenol to give the orthoformylated product, and the correct answer is option A, that is carbene. Next question is which of the following is not added to chewing tablets, and the correct answer is option B, disintegrant. Next question is range of CO stretching in enol is, and the correct answer is option D, 1655 centimeter inverse. Next question is match the following phytochemicals with their source and use. So the first phytochemical, that is shatabrin, it correctly matches with option number 4, that is asparagus and galactogogy. Next phytochemicals is resveratrol. Resveratrol. And it correctly matches with option number 3, that is purple grape and anti-inflammatory and anti-cancer. And the glucosinolates, it correctly matches with option number 2, that is broccoli and cabbage, and it protects against bladder cancer. Next is rutin, it correctly matches with option number 1, that is buckwheat and citrus fruits, and it strengthens capillary walls. So the correct answer is option A. Next question is which RNA polymerase is the only whose product are capped? And the correct answer is option B, that is RNA polymerase 2. Next question is match the scientist awarded with Nobel Prize with their contribution. First is Alexander Fleming. It correctly matches with option number 3, that is penicillin. Kobilka, it correctly matches with option number 1, that is GPCR. Venting, it correctly matches with option number 4, insulin. And black, it correctly matches with option number 2, beta blocker. So option C is correct for this question. Next question is mean arterial pressure is, and the correct answer is option C, that is diastolic alcohol plus 1 by 3 into pulse pressure. Next question is eugenol is, and the correct answer is option D, phenylpropene. Next question is the vitamin required for carboxylation of pyruvate to form oxaloacetate is, and the correct answer is option B, biotin. Next question is which of the following circled hydrogen is most acidic? And the correct answer is option C. Next question is the drug formulated as suspension follows dash order reaction. And the correct answer is option A, zero order reaction. Next question is which diuretic causes decrease in release of insulin? And the correct answer is option B, ethacrinic 0. Next question is match the following drugs with their mode of action. First drug, that is methotrexate, it correctly matches with option number 2, that is anti-metabolite. Cyclophosphamide matches with option number 3, that is alkylating agent. For vincristine, it correctly matches with option number 1, that is mitotic inhibitor. And dactinomycin, it correctly matches with option number 4, that is intercalating agent. So option D is correct for this question. Next question is which compound would be expected to show intense IR absorption at 3300 centimeter inverse? And the correct answer is option B, that is CH3CH2 C double bond CH. Next question is in the carbon NMR, in what region of the spectrum does one typically observe carbons which are part of the aromatic ring? And the correct answer is option D, 120 to 150 parts per million. Next question is meclofenamate belongs to which class of drug? And the correct answer is option C, that is aryl antranilic acid. Next question is match the following crude with their chemical constituents. So the first option, that is aloe, it correctly matches with option number 3, that is valvaloin. Then next is ginger, it correctly matches with option number 4, that is alen. For lemon peel, it correctly matches with option number 1, that is hesperidin. And for olive oil, it correctly matches with palmitin. So option C is correct for this question. Next question is dopamine agonist with tetraline function. and the correct answer for this is option D, that is roti gotin. Next question is the IUPAC name of the compound CH3CH3 CHCH2Cl is, and the correct answer is option A, that is 2-methyl 3-chloropropane. Next question is a powerful inhibitor of stromatal opening is, and the correct answer is option D, abscisic acid. Next question is what is the renal clearance of a substance if its concentration in plasma is 10 mg, concentration in urine is 100 mg, and urine flow is 2 ml per minute. So the correct answer is option D, 20 ml per minute. Next question is aim of pharmacovigilance is, and the correct answer is option A, that is to monitor drug toxicity. Next question is phase 0 studies is an P is exploratory investigational new drug study, Q is human micro dosing studies, R is step to speed up drug delivery development process, and S is mandatory by FDA. So the correct answer is option C, that is P, Q and R. Next question is parenteral product must be, and the correct answer is option B, they must be sterilized. Next question is quinine present in highest amount in, and the correct answer is option C, C. ledgeriana. So that's all for today's video. मिलते हैं अगली वीडियो में जिसमें मैं डिस्कस करूंगा GPAT 2015 ईयर का क्वेश्चन पेपर. So thank you very much.